Dr. Tania from Vet in a Van, and today I'm going to talk you through using our first aid kit to manage a small wound on your dog or cat. So in our first aid kit, open it all the way up. This is Honey, our model for today. She doesn't have a wound, but we're going to pretend that she does. It's pretty common for a dog to get a cut on their pad or their paw or their leg. So we'll talk you through this one. Inside our first aid kit, say she had a small cut on her, on her paw, top side or bottom side, doesn't really matter. Inside here, we've got some swabs. If the wound is bleeding, then it's ideal to apply some pressure to try to stop that bleeding to begin. So you can just grab a couple of swabs. Oops, you're all right. Oops, catch. Grab a couple of swabs, and on her cut paw, we're going to just hold them over the surface and apply pressure for about a minute. With a small wound, bleeding should stop within that minute. If that's the case, then we can go on to dress the wound and keep it nice and clean. If that bleeding continues, then you need to continue to apply pressure and seek veterinary attention. Inside our kit here, we have some gloves, chlorhexidine, which is an antiseptic for cleaning wounds, bandaging materials, so your swabs. Melalin is a non-stick dressing that goes directly on the wound. Bandages of a couple of different sizes depending on how big your dog is and what area might need bandaging, and some elastoplast, which is stretchy tape. So first of all, pop your gloves on. This is so we don't add any extra bugs that might be on our hands into the wound, leading it to be more likely to get infected. So gloves on. We've stopped the bleeding already using pressure with our gauze. We can then get our chlorhexidine antiseptic. This does sting a little bit in an open wound. Twist the top off, and we just dab it on the spot where she has her wound, in this case a pretend wound, but where your dog might have a wound. And then we can clean the wound a little with our swabs. It's pretty unlikely for a dog to want to lick chlorhexidine. It doesn't taste very nice, but she just wants to know what I'm doing with her foot right now. Once the wound is clean, we've given it a really good flush with the chlorhexidine. We grab our Melalin. The Melalin has a shiny side and a dull side. It's shiny side against the wound. This is a really huge 10 centimetre by 10 centimetre piece. So the idea is to cut a little square in it, about the same size as your wound. So we grab our scissors from inside the lid of the first aid kit. We cut ourselves a little square. That's the size of the wound. And then, given that it's on her foot and she's a small dog, go for the small bandage. Now, with this cohesive bandage, it's designed to stick to itself and not stick to the dog. So it's really good in that it doesn't pull all their hair out when you try to take it off again, but it is very stretchy. So we don't want to make it too tight because it will cut off the circulation to the rest of their foot, which we really don't want. So I like to loosen it up first, just by loosening that little bit as I just did, and roll it back down. That way I know I'm not going too tight. So I've got my piece of Melalin, shiny side towards the dog. We've got our wound that's no longer bleeding, has been well flushed with chlorhexidine and is nice and clean. We pop our melalin on there. Start your bandage over top of where your melalin and wound is. Honey's being very good for me at the moment. Some dogs don't like their feet being touched or won't like being bandaged, so you might need a helper or some food to distract. Head down towards the toes. Ideally, we would like to completely cover her toes in. The idea behind this is that if you leave her toes hanging out the end, then the firmness of the bandage can restrict blood flow into the ends of the toes and both become uncomfortable as well as cause swelling in her toes. So then we're going back up the leg again now. As you can see, I'm pulling the bandage out, letting it rest again before I wrap it around. I don't want to pull it out tight and then wrap, because otherwise the elastic will make it shrink down onto the leg and we're too tight on her leg. So we've got it to there. This bandage is quite easy in that you can tear it with your hands if you have to, but we do have our very handy pair of scissors here, so I will cut it. And it sticks to itself, so you don't need anything to stick it down. If your dog really doesn't like having a bandage on its foot and is sitting there flicking, sometimes the bandage will come flying off the end. So that's where our elastoplast tape comes into effect. Likewise, this is medical tape that does have an elastic property to it, so it is stretchy. And likewise, we don't want it to be too tight because it will cut off the circulation to your dog's foot. So I just loosen some up, tie it back on, and putting it onto her leg. Start with a diagonal. This helps to reduce the risk of cutting off blood supply. Come up. My aim is that the tape is, if you can see underneath her beautiful feathers, is to be half on her fur and half on the bandage. So we go around once, not too tight, just keep it nice and loose, and then to finish off, come back down in a diagonal again. Trim it off with your scissors, and that's just enough to keep it anchored and hold it on to her fur. So that she should be pretty nice and comfortable. That way it'll keep the wound clean, it'll keep her comfortable, it'll stop her from licking at it and making it more infected, and give you time to get her to a vet where they can assess the wound, decide whether it might need stitches or surgery or even antibiotics or extra pain relief to help it recover. There we go.